Hi, this is SGD 166. I am Brad Swearingen, your instructor, and today we're going to be talking about bones and surface landmarks, and we'll also have a few fun facts about some bones as well. So we'll get started. This is humans, and we'll see some drawings as well that have the skeletons in them. You'll see the bones, and also you'll see the outline of the skin of the human form around the skeleton. So let's go ahead and get started. All right, so here's a picture of the human skeleton in 5 different modes. You can see we have a posterior view, we have a medial view, anterior view, frontal view, and then we also have kind of like a 45-degree, couple 45-degree angles here where you can see the back at a 45-degree angle, and then you can also see the front at a 45-degree angle as well. And this is just basically a standard skeleton that we'll see. All right, so bones. What is the purpose? Well, the purpose of bones is to provide framework for the muscles to attach to, and also they provide framework for movement, and they also provide bony landmarks for artists so that we're able to use the landmarks that we can see when the bones kind of protrude out, and you get to see them on the surface stretched, whether they're stretching against the skin. We can use those as landmarks to kind of help us to be better artists, kind of as drawing points. So we'll take a look at those as well. So here's some basic anatomy vocabulary that we'll take a look at, and you'll have to know these for the entire semester. So just make sure that you're familiar with the terms. Anterior means just a view of the front of the body, anterior. The posterior is a view of the back of the body. Lateral means a side view of the body, and it can be either side. And then medial means it's toward the midline of the body. And what that means is if you were to start at your head and draw a line down the center of your body, objects or body parts that are closer to that center line or the midline of the body, that's what it means when we refer to medial. And then when we say superior, that is if you are looking down at the skull, looking down at the body. And then inferior means that you are looking from below and you are looking up at the body. So those are the terms, and be familiar with them for the rest of the semester. All right, a couple more terms here that we have. Dorsal, and you may have heard that term before, such as like a dorsal fin on the back of a fish or a swimming animal. Well, dorsal is actually for humans. It can mean the back of the hand, and it's also used for the back of the foot. So we have the dorsal side of the hand and the foot. Palmar, that's hopefully pretty self-explanatory, is we have a palm in our hand, so palmar means the palmar side of the hand. And then also we have plantar, which means the sole of the foot. And so when you plant your foot on the ground, that's a helpful way for you to think about it, is that when you plant your foot on the ground, the side that's on the ground, that's the plantar side. Then also we have proximal, which means nearer to the torso. Proximal, which means nearer to the torso. And distal means further or away from the torso. And think about your fingers. Your finger has 3 bones in it. And the finger can be pointed away from your body. If you stick your pointer finger out and point it away from your body, then the tip of your finger, that bone in the tip of your finger, that is the distal bone. It's farther from the torso than the bone right next to it, the middle bone of your finger. And so we would say that bone is proximal because it's nearer to the torso than the bone that is at the tip of the finger. So that's where those terms proximal and distal are used, is because I can take my finger and point my finger at myself. And so now you might think, well, now it's nearer to my torso, but not really. We want to follow it, the line, all the way down my finger, my hand, wrist, and down my arm. And so we're actually following the line of your arm, not what direction your finger is pointing. So that's the difference. All right, so hopefully you've got those terms down. Let's take a look now. There are two different basic parts of the human body, and we call these parts, we divide them up between axial and appendicular. Axial and appendicular. So here's the difference between the two. The axial body contains the head, the neck, and the trunk, or you could also say the torso, but it does not include the arms. Then the second part of the body is the appendicular body, and that has the upper extremities, meaning the arms, and then the lower extremities, meaning the waist, from the waist down, so it would be your hips and then your legs as well. And it also includes hands and feet. When I say arms, in this case, arms and hands, and then also legs and feet. And you can see, because of the different colors here, dividing up between the axial and the appendicular part of the body. All right, the next slide here. So here's kind of a little better list of it. So the axial gives us the torso, the neck, the cranium, the vertebral column, and the rib cage, whereas the appendicular gives us the upper limbs, the lower limbs, and the primary function of them is to support and move the axial skeleton and to allow movement of the limbs. So these are purposes of the axial and appendicular. So with the axial being on the right and the appendicular being on the left. All right, next slide. Here we see there are 4 categories of bones, 4 different types. So we have long bones, short bones, flat bones, and then there's these bones called irregular bones. Let's talk about those in just a moment. So here in our bones, long bones are going to be found in our limbs, and here you can see a humerus, and it's in the upper arm right there. And then we also have long bones in our forearm, in our legs, and each of these bones has different names that we'll take a look at later. Then we also have these short bones, which are carpal and tarsal bones. Carpal and tarsal bones. So we have these little short bones, and you can see here they are, little short bones right inside here. That's your wrist. And then we also have flat bones, and flat bones might be the sternum. That's this bone right here we see in the letter D, the picture D, sternum. And then the ribs are also flat bones, even though they've got kind of an unusual shape to them, where they start at the back, they're attached to our vertebrae, and then they curve around towards the front. And but we still call the ribs are still called flat bones. And then we have these irregular bones. They can also be called sesamoid bones, irregular or sesamoid bones. Our vertebrae, where you can see right here this picture of a vertebrae. It's got these little pieces poking out of it right there. We'll learn more about those later and what they're called. But this is a vertebra, and it's very unusually shaped, so it's an irregular bone. And also the bones in our skull are also considered irregular bones, and up in there. So just some different categories of bones that we're going to be learning about. And keep in mind, this is an overview at the beginning here, so we're also going to take a look at just some fun things as well. So bone lengths usually are proportionate to the person. So if you are a shorter person, then your femur, which is in your leg, your upper leg bone, is going to be proportionately shorter in proportion to your body. Or if you are taller, then it's going to be proportionately longer. Now that's the rule, but there are going to be exceptions where sometimes you can have, somebody that may have a longer torso, or you might have someone that has longer legs, but from the torso up, they're just regular size. So there's different proportions, but as a rule, usually the bones are proportionate to the rest of the person. Here's kind of a fun chart that I found, and if we think of a regular person as being 6 feet tall, there have been skeletons that have been discovered. You can see some of these on the internet, and some of them, you never know if this is fake news or if it's real stuff, but it was kind of fun, so I thought I'd post it out here. Some people have declared to find skeletons up to 36 feet tall. And but anyway, these skeletons you'll see that some of them are in proportion to what it looks like as if you were only a 6 foot tall person. So, but anyway, like I said, we'd go through some fun stuff as well, and just fun to look at. All right, here is a did giants really exist? And here's a picture of a bone. I don't know if that bone is real or if it's made out of plaster or something like that, but they're just trying to give you an idea of somebody who is extremely tall, a giant that existed. And there's a femur, and that femur is probably almost about 5 feet long itself, probably about 4 to 5 feet, depending on how big. If this guy's, about 5'8", something like that maybe, then this femur is probably about 4 to 5 feet long. Anyway, again, kind of fun stuff you can find on the internet. And let's take a look. All right, so now basic bones of the skeleton. Now, I'm not going to read all of these, but you will need to know the names of all of these bones that are highlighted here. So I'm going to go over most of them. So for instance, in our arm, we've already talked about the humerus, which is the upper arm. In the lower arm or forearm, we have the ulna and the radius. And we'll go over later which one is which, because we have 2 bones in our forearm. But one of the important things to know about this is look what forms the elbow. It is the ulna forms the elbow. All right, so we're going to start up here. We've got the cranium, which is also called the skull. Down here we have our cervical vertebrae, and we'll talk about how many of those there are, and they have different names as well. In the front we have clavicles. The scapula is actually in back, but you can see just a little bit of it there. Also in the front is the sternum. Remember we said that was a flat bone, the same as the ribs are flat bones. We have lumbar vertebrae in our vertebral column. We have a very large bone here, the pelvis. And then down in our wrist, we have carpals in our wrist, carpal bones. And then our finger bones are called, or our hand bones are called metacarpals. And then the fingers are called phalanges. Phalanges. And so we'll talk more about the phalanges. So in the wrist and hand, we have carpals and metacarpals. And so don't get those confused with down here in the ankle, which we'll talk about in just a moment. So leaving from the pelvis, we go down into the femur, and then our kneecap is also called our patella. And then we have 2 bones in our lower leg, the tibia and the fibula. And then down here, just like we had carpals and metacarpals, in our ankles we have tarsals. That's all the bones in our ankle, tarsals. And then in the foot bone here, they're called metatarsals. And then just like our fingers are called phalanges, our finger bones, our toe bones are also called phalanges. So those are all the bones from the anterior view. And then we'll take a look at the posterior view. And some of the same bones from the front that we can see. A couple better views here from the backside. We can see the scapula, and we do have scapula, right and left side scapulas here. Here we see the vertebral column. So we have cervical vertebrae up here. In the middle, we have thoracic vertebrae, and then down here, we have the lumbar vertebrae. Then we also have a bone called the sacrum at the end of the vertebral column. And let's see if there's any we missed here. And all the others, there's one more down here, very end, the calcaneus, which is the heel bone, the calcaneus. All right, let's keep moving on here. So when you are drawing as an artist, we mentioned that one of the purposes of bones for an artist is so that you can find surface landmarks to help you become a better artist when drawing the human figure, or even in our case as being 3D modelers, in order to be a better 3D modeler of the human form as well. Because when you're modeling for video games tend to have a lot of characters, human and animal characters, and so we have to learn how to model and make the proportions look correctly. And if we want to distort them and make them look differently, then you need to know how to do that. But these bony landmarks and surface landmarks are very important to artists. All right, so let's take a look at landmarks. We have soft surface form landmarks, which would be muscles, tendons, ligaments, fatty tissue, stuff like that. So those landmarks can be easy to be seen. An example of that, the muscles, think about the bicep. And so when my arm is outstretched, the bicep can be very flat. And then as you raise your arm up to make like when little kids are, look, Mom, I'm strong, I'm making a muscle. And you can see the bump of the bicep there, the muscle. And so that would be a surface form that we would want to look for. All right, there are hard surface forms as well. Parts of bones can be hard surface forms, ridges. And here's an example of a ridge. If you think of your clavicle, which it's more commonly known as a collarbone. So you can hold on to your collarbone or your clavicle, and that is a ridge there, going from pretty much from your shoulder over to your neck. And so that's the kind of ridge thing that we might look for. Then there's little bumps as well. Bumps, an elbow would be a bump, or also in your wrist. And you'll notice that there's a bone. If you follow your pinky down and then down your hand, there's a bone right there. There's kind of a bump. And that bump is going to be a landmark that you can use when you're drawing to get good proportions with your hand and your arm. And then also there's going to be little depressions that are made in the skin when the bone sticks out as well. So look for these soft surface forms and look for the hard surface forms as an artist. And you should improve your proportions pretty quickly. Start improving pretty quickly. All right, so here's a couple examples then of landmarks. Clavicles, which I already talked about, elbows, knees, wrist, rib cage. These are all great examples of landmarks that you can look for. And you'll be able to come up with your own as well, because we have so many bones in our body that they can create many good landmarks for us to be able to use. All right, next we're going to take a look at some parts of the bone. So even though the bone has a name, some bones even have parts that are labeled on them as well. So the cranium is pretty much all one bone except for this jawbone. And another name for the jawbone is called the mandible. So our head is made up of pretty much of two bones. There's the cranium and then the mandible. We're not going to count these. We're not going to count these cervical bones right there. So two bones in the skull, and cranium, and then the mandible right here. Now, in these bones, they have different landmarks, and you can see there's different landmarks here. Something called the zygomatic arch. In our cheekbones right there. You can even feel that on your face. If you were to kind of feel your cheek up around your eye there, you'll feel that zygomatic arch right there. We already talked about the clavicle. You can even feel your sternum, your breastbone. There's the thoracic arch there that you can feel on your rib cage. Other things that you would be able to feel is the acromion process, which is the tip of the shoulder right there. And so you can just feel that. And I do recommend, as we're talking about these, that that you kind of try to pinpoint these on yourself and try to find where is the tip of my shoulder there and feel that and the acromion process. Another thing that you can do in order to help these to become more prominent or even less prominent, for instance, the acromion process here, the tip of the shoulder, is that if I keep my elbow tucked into my side, I can feel that. I can feel that acromion process right there. I can feel the tip of it. But what if I pull my arm out to my side there? Then it becomes even more, I don't know, I can just feel it better because the muscle tends to move away from the bone when I extend my arm out straight out to my side there. And so that tip of the shoulder allows me to feel it a bit better. And if you'll notice on your own self there, it also creates a little divot right there, a little cavity right there. And so that's another little landmark that we'll be able to use. So some other landmarks I'll just go through quickly. We have the medial and the lateral epicondyle of the humerus. So you can feel those on yourself as well. That would be the inside. If your palm is facing forward and your arm is hanging down at your side and your thumb is out, not in, but out, and the palm is facing forward, then you get the medial epicondyle of the humerus. You can feel that bone. And then you also get the outer epicondyle of the humerus right there. You can feel both of those landmarks. Down here, we had the styloid process of the radius. And you remember we talked about that bone just a minute ago that was coming down from our pinky through our hand. And there's a little bump right there, right? That's actually the head of the ulna. What else did we say the ulna formed? What else did we say? It's the elbow, right? And so we'll look over here, and there it is. It's called the olecranon process of the ulna, and that's the elbow. So the ulna forms a lot of these bony landmarks in our arm there. It forms this the head of the ulna, and it forms the elbow right there. So, all right, very good. Let's see a couple others. Some other things that you'll be able to pick out really well is this iliac crest of the pelvis. Iliac crest of the pelvis right there. And you can feel that's kind of the bone that sticks out, and that's when we wear a belt. That's kind of the bone that our belt hangs on in order for us to keep our pants pulled up and so they don't fall down, is that iliac crest right there. And so when we tighten our belt or cinch our belt right up here above that, then it can't go below where the bone is because the bone is so solid. And so that iliac crest right there helps us, keep our pants on. So anyway, so there's that landmark, and you should be able to feel that pretty clearly on you. Then we have the greater trochanter of the femur. That sticks out right there, and you can actually feel that one as well. And so you can feel that greater trochanter of the femur in there. Let's move down a little bit. The patella, the kneecap, that's easy. You can see it, you can feel it. And if you'll notice that when you're walking, your patella, your kneecap, is pretty tight in there. But if you just relax your leg a little bit and straighten it out and relax it, it relaxes so much that you can move that kneecap, move the patella around inside there just a little bit. I wouldn't move it too much, but you can just kind of play. It's got a little bit of play in it, really. And it can be moved around a little bit. But your leg has to be straight. When your leg is bent, that patella becomes pretty secure. It's called packed in there. It becomes pretty packed, pretty solid, and you're not able to move it. Also, just like we saw in the humerus where we had the epicondyle there on either side, down here on our femur, we have lateral condyle and the medial condyle of the femur, right and left side right there. And you can feel those. That's a pretty hefty bone, that femur, and you can feel both of those in your leg. And then there's the head of the fibula. And notice that that's on the outside. The fibula is on the outside of the leg. And the big bone, this one right here, this is the tibia. And if you think of that line, there's kind of almost like a line. When you're walking through your house at night in the dark and you forget there's a coffee table there and you whack your shin bone, you just hit the tibia and you've hit it on that front line right there. And sometimes you'll even hit that tibial tuberosity right up there, and it's really painful. But that's what hurts, is that tibia that you just whacked in there. And sometimes you can feel that tibia. Relax your leg, feel that tibia right there, and you might find that there's some ridges along that tibia. Well, what happens is those ridges are caused when you bump into stuff over your life, however long you've lived, 18, 20, 25 years, and you may have whacked a couple things, whether it's playground equipment, your bike, if you play sports, or just bumping into tables in the dark of night. And they can create little divots in your bone there because you've hit bone against wood, and so you may actually have a little ridge there from depending on how many things you bang into. And let's see, down here you'll notice we have two bones, one on the inside of our ankle, one on the outside of our ankle. The inner ankle, it's called the medial malleolus. And the outside of the ankle, that big bone out there, is called the lateral malleolus. So we have two big bones here, and this one is from the tibia, and that big bone right there, and then the outside, the lateral malleolus, the outer ankle right there. And then inside here we have the talus, and then we have the metatarsals. Now remember, if these are metatarsals, what are these ankle bones called? Right, tarsals. So we have tarsals and metatarsals, and then we have the talus right inside there. All right, and back here, let's look at the back side just a little bit. Because remember, we're looking at landmarks, and all these yellow areas are highlighted to show us bony landmarks. So even back here in the scapula, you can see bony landmarks. Back here, the sacrum, if you will notice, if you can get in a mirror and kind of look at your backside, your posterior a little bit, you'll notice there's kind of a flat area back there where the sacrum is. And there's not a lot of fatty tissue on there. There's not a lot of muscle, and but it's kind of almost like a hollow area back there. But that's where the sacrum is. And let's see, what did we not look at here? How about this? The calcaneus, the heel bone, right back there. It's a good landmark for the foot. And I guess that's it. That's all we'll look at for these pictures. So anyway, when you need to look for bony landmarks, these are a couple good pictures in order to go look at. Now you'll notice also here in the cranium that you can see some of this. It says if there is no hair. And so if someone is bald or if they shave their head or whatever, sometimes you can see this, and especially back here, you can see those landmarks right back there. And so it helps you to be able to get a good proportion for the head. So, all right, good. Let's keep moving on. All right, so here's something about the cranium, is that whenever, as an artist, and in this whole semester, I'll be trying to relate things as an artist. How would an artist look at this? How would an artist want to see this in order to be able to improve their drawing, their modeling? So one of the things the author suggests from our textbook is that if we can take the shapes of our bones and relate them to something we are more familiar with, then that can help us remember what the shape is like. So the author actually thinks that our head, the cranium, looks like an ostrich egg. And we'll actually look at pictures of ostrich eggs later on. But an ostrich egg is huge. And so it's as big as our head. And so our head looks like an ostrich egg, and it consists of actually 8 separate bones which have been fused together. So now there's just one bone called the cranium. Now, our cranium also has a second portion. Even though it's one cranium, it actually has 14 individual facial bones. They all have names for their designations. It's located in the front of the cranium, and they are all fused together except for the mandible, and which we already looked at. So really there's 2 bones. This will not be a trick question on a quiz or an exam. And so because these 14 individual bones, they're fused together. So they're just one bone. It's called the cranium. And so now we've named these individual facial locations on the cranium. All right. So on our cranium, here's a couple examples, some more of the common ones. The zygomatic bone, which we already talked about. And what was our zygomatic bone? Right, our cheekbones, right? We said because we could feel those kind of down from the eye and in between the eye and our cheek there. So it's called the cheekbone. Then we have the chin bone. We have the nasal bone, which remember, the outer tip of our nose is actually made of cartilage. And so it's flexible, so you can take your nose and you can kind of move it back and forth a little bit, because bone, you can't really bend bone. You can a little bit, but it's not really supposed to bend too much. But our nose actually bends quite a bit because it doesn't have a bone in it. It has cartilage in it, but it is attached to a nasal bone, which is back further from it. That's not the part that's bending. It's the cartilage that's bending. Then we have the orbits. That's where our eyeballs go. They fit in these orbits. And then we have the mandible, which we already mentioned is the jawbone. All right, the only movable joint in the cranium, now this is not a bone, this is a joint. The only movable joint in the cranium is called the TMJ. And it stands for temporal mandibular joint. temporomandibular joint. So it's called TMJ. And some people, if they have problems with their jaw, opening their mouth very wide, having some pain there, some people may tell you, oh, I have TMJ. Well, yes, we all have TMJ, actually. What they really mean to say is they have TMJ disorder, TMJD, TMJ disorder. So because we all have that temporal mandibular joint, it's the only movable joint in the cranium. All right, let's take a look at the cranium. Here's a good picture of it. Here we can see those things we just mentioned. Here's the orbit, one for the left, one for the right eye. And let's take a look at some of these portions or locations now that we mentioned earlier. Here's an eyebrow ridge, and some people have more prominent eyebrow ridges. Here's the glabella area right in between, kind of right where the eyebrows are, right in between that, the frontal bone, which is our forehead. Let's move on down. Now, we talked about the nose. The part you can wiggle, move, is cartilage, but here's the nasal bone right here. There's the nasal bone. And you can see that it's pretty tucked back into the face there. The nasal cavity, where we breathe. When we breathe the air in, air goes through this cavity and then goes down into our lungs. And then we have a part called the maxilla, which is our upper jaw. And then we have the mandible, which is our lower jaw. And the chin region. And then, like we mentioned, the zygomatic bones here on either side. Here, looking from a lateral view. Lateral, remember, means side. What's the, well, I guess it said anterior view. So we have an anterior view and a lateral view. All right, now you can also see we have a temple line here. And that line, again, will help. Notice how it goes kind of right in between this ridge right here, and it goes in between the top of the skull. So again, another good landmark for us to be able to use for drawing. Now we have this thing called the occipital protuberance back here. Occipital protuberance right back here. And notice that the back of the head kind of comes down vertically, starts to curve in just a little bit and goes more horizontal after this occipital protuberance right there. So it starts to curl back in. It's not like a basketball where it's perfectly round and comes down here. Nope, it starts to get more horizontal here. Then we have external auditory meatus, which is our ear canal. There's a hole there. So sound waves can go into there, be processed by our brain, and we hear them as different noises. The mastoid process is this area right here that sticks out of the cranium. We also have the angle of the mandible right here, upper and lower dental arches. And then we have the neck, which we have cervical vertebrae in here. And so we just see a few of them, and we'll look more at those in just a moment. All right, let's see. In here, cranium with facial features. So here you can see the skull right inside here, and then there's an outline of the actual human head drawn around it. So you get to see a little bit about what would it look like with flesh on it. You can see some hair on there, how everything fits in there. There's an ear covering up the auditory canal, and then we see some flesh kind of around here. So that zygomatic bone there, it kind of holds up our flesh right there. Okay, keeps our flesh held up right inside there. And you'll notice with models, we like them. We like to see them with high cheekbones, and that's what that is. And some people's cheekbones are just more prominent than others. Now here's the ostrich egg resemblance. So here's our cranium, our skull, and here's a picture of an ostrich egg, or I guess a drawing of an ostrich egg, kind of in the shape of the human skull. It's just an easy way to kind of remember, because our skulls are not shaped like balls, not like a baseball or basketball or soccer ball. It's more oval shaped, kind of like an egg. So that'll help us to remember that. From the here we can look at the frontal bone here, and the glabella is right inside there. The zygomatic process we saw down there, the brow ridge, and it's kind of in the shape of a crab. And so that's how we can remember that. Now, it's not perfectly, because it's a little bit more rounded up here up top, and this is a little more horizontal. This line is right there, but it's kind of in the shape of a crab, so we kind of remember that. Down here, we see the nasal bone and the nasal cavity. We see nasal cartilage is right here on the tip of the bone. the nasal cavity right inside there. And then these things, where we know them as nostrils, but it's actually, they're called the wings of the nose. Nostrils are wings of the nose. So we'll take a look here at the wings of the nose, and people have different size noses. Even these three are different size noses, different drawings. So we have a narrow nasal cavity, a medium, and then a wide nasal cavity. And notice that the end of the nose here, on this particular person, it looks like a ball on the end of the nose. And so some of these are more prominent than others, but not everybody has a ball on the end of their nose. Some people have more of a point on there, and there's just different types. All right, let's keep moving on. Here's a lateral view of the mandible. Now we're going to see close up here. There are different parts in this. Now keep in mind that the mandible is the only movable bone in the cranium. Here you can see, here's the TMJ, the temporal mandibular joint, right? And this little piece of the bone right here is called the condylar process. The condylar process right inside there. Here is the coronoid process. And anytime the bone has kind of like a protuberance along there, we usually will, that's called a process. So we have a process right there sticking out, but that's the condylar process, the coronoid process. Remember we saw those the vertebra right there, and we had all those like 5 different spiky points that were coming out of our vertebrae. Those also are called processes, and they have different names, which we'll get to later. All right, this is the ramus. Here's the angle of the mandible, which is the corner of your jaw. You can feel that, and that changes depending on how you move your jaw and when you're talking and eating. Here's the body of the mandible, the mental protuberance here, which is called the chin. And then we have the upper and lower dental arches. All right, next, we can see that the mandible, if we look at it from what kind of a view? So keep in mind, we're looking down as if we were looking down on somebody, and so that's called a superior view. Here's the lower dental arch, the body of the mandible, the coronoid process that we just saw earlier on that last picture, the ramus, the condylar process. And it resembles kind of a horseshoe. Not perfectly, because, we get this wider body here in the middle where this starts to get a little bit narrow, but it's just basically, it's in general terms, it looks like a horseshoe. All right. So anyway, let's go to the next one. All right, here are some dental occlusions, 3 different types of dental occlusions. We have edge to edge, which is good. Edge to edge, well actually, edge to edge is not good. You don't really want edge to edge right there because this is a dental occlusion. And overbite is where the upper dental arch goes over top of the lower dental arch. And then we have an underbite, which is where the lower dental arch sticks out further than the upper dental arch. And here you can see the different shapes of the face by the artist's outline there, depending on what kind of an occlusion they have. So, all right, next, the vertebral column. Here's a lateral view. Now remember, I told you these little spiky pieces sticking out here, those are called processes, and each one of them has a different name to it. Let's take a look. Here we have the body of the vertebra. And if it's one vertebrae, then it's called a vertebra. V-E-R-T-E-B-R-A, vertebra, or vertebrae. And, or I guess vertebra, sorry, vertebra. And then if there are multiple, if you're talking about more than one vertebra, then it's vertebrae. Vertebrae. So here, this one sticking out the middle here is called the spinous process. The spinous process. Here we have the surfaces. Now there are many surfaces because this is an irregularly shaped bone. So they have a lot of names on their surfaces and the things that stick out there. It's the superior articular facet. The transverse process sticks out the one side and the other side. There's a vertebral arch in here. There's the body. And then here's the vertebral foramen right inside there. That's just that hole. And that is where the spinal column goes. All right, here's a lateral view. We see the body, again, of the vertebra transverse process, that little piece right there that sticks out, that's this piece. And then we see the spinous process right there as it sticks out. You can actually feel that spinous process on your vertebral column if you just kind of reach your arm back, either behind you from lower, or if you go over by your head and you kind of lean forward a little bit, and you can actually feel those bones. You can feel those spinous process on there. Now let's take a look at the vertebral column. And we've talked about it. And we said there are vertebrae here. We've talked about cervical, thoracic, and we talked about lumbar. But we didn't say what specifically they are. So let's do that now. Each of these vertebrae have their own names. And they start with, we'd call it cervical, because these first 7 vertebrae, starting at the skull, the cranium right up here, they're named C1, C2, C3, 4, 5, 6, and then finally C7. So there are 7 cervical vertebrae. Now the first 2 actually have additional names. C1 is called the atlas, and C2 is called the axis. And we'll learn more about those in just a little bit. I don't want to go over that right now, so we'll do that in just a bit. I have a couple other slides for that. So we have 7 cervical vertebrae. Notice the way they curve. So it starts up here kind of at the top, and it curves down and to the right, looking at it from this lateral view. Then we have the thoracic vertebrae. Look at the curve here. This curve goes the opposite direction of the cervical curve. The thoracic curve starts pointing up and to the left, comes down, and then goes down and to the left. But there's a curve in the middle there. These thoracic vertebrae are labeled T1, T2, T3, all the way down to T12. So they're just giving designations T1, T2. None of these has their own name like the atlas and the axis does. These are just T1 through T12. Then as you get lower, here we see the lumbar. And you may, maybe your vehicle, your car, has a lumbar adjustment, or maybe you've got a really nice easy chair that you love to sit in, or even your office chair, your desk chair, and they have lumbar supports in them. And that's what this is doing here, is it's putting a little bit of extra padding or something there. Your chair, your chair that you sit in, or your car's seat. And what it does is it actually gives you some extra support there in the lumbar region to support this curve right here. And so we had 7 cervical vertebrae, we have 12 thoracic vertebrae, but we only have 5 lumbar vertebrae. So 7, 12, and 5 equals 24, right? So because 7 and 12 is going to be 19, and then we're going to add 5 more up to 24. So we have 24 vertebrae in our vertebral column. All right. So down below that, we have our sacral region and the sacrum right here. And then down at the very end, we have this tiny little bone right there. We call it our tailbone, but it's officially called the coccyx right there, coccyx. And so we have the sacrum, and then we have the coccyx. Now sacrum, actually, if you look in the dictionary, it's pronounced, they have both pronunciations where you can have a long A sound and call it the sacrum, or you can call it the sacrum. Either one, I've looked it up, and so you can call it either one. Sacrum or sacrum, either one is correct. And just be aware that this is the sacral region down here with the sacrum, and then the coccyx right down there. But look at the different curves here of each of these regions. C1 through C7 goes one direction. T1 through T12 goes another direction. L1 through L5 go a different direction. And then even the sacral coccygeal curvature line here goes a different direction. So all adding to our posture and what we have here. All right, we've been going for about 45 minutes. And so what I would like to do is take a quick break. And I'm going to cut this part of the lecture off. This will be part 1. And then we'll pick back up with part 2 on the next one. Thank you very much.